going to get started in just a moment. See, we have some patients join the webinar, haven't seen in a while. So thanks for joining in. Good to see you, Lucia. Miss you guys. Hope things are going well down south. Sherry, I saw your mother recently. She's a smart lady. Enjoyed seeing her. Hey, Michael. Hey, Melanie. Lane, thanks for coming. Just give it another minute for some other folks to join and we'll get started. Hi, good evening. Okay, well, it's a couple of minutes after 7 and we'll get going. So again, welcome to our webinar. And we're going to cover some topics on sleep tonight. And again, I want to welcome everybody. I want to thank Dr. John Montague with Designs for Health for helping us out tonight. Again, my name is Dr. Mark Stagg. I've been in practice for 20 years. I'm the owner of Whole Health Wellness Center. I'm a certified acupuncturist and a certified sports physician. Some people may wonder, why is a chiropractor doing this webinar on sleep? Well, sleep is such a integrated component of many other conditions that is highly intertwined with conditions that we treat that are pain related. Dr. John, maybe you could just tell us a little bit about yourself before we get going.
Yeah, I'm Dr. John Montague. I've been in the natural products industry for the last 30 years. Past president of the Natural Product Association, and so this has always been a topic that's been dear to my heart. I've had sleep issues, so I always find this to be a very interesting topic and very helpful for people.
Okay, thanks again, John, for joining us. So if you have a pen and a piece of paper, that would be great. Really important with sleep conditions to keep a sleep diary. So you can start your sleep diary to find out what works, what doesn't. We're going to try to give you as many solutions and strategies as possible to help you with your sleep problem. We're going to try to answer questions in the chat box as we go along and as time allows. At the end of our webinar, we'll allow an area where you could make an appointment to have what we call a discovery call with our office, where one of our medical office assistants can deal with any questions regarding the webinar, areas that were unclear to you, or if you think you need to speak with one of our naturopathic doctors, or you need a chiropractic evaluation. So we'll get into that at the end. Just a couple of statistics on sleep disorders. It is known that 1 in 3 people at any time are suffering from a sleep disorder. That means 70 million Americans are having sleep problems at any time. 15% of these are chronic, long-term conditions that need a lot of support. 1 in 2 of us will have a short-term insomnia event over our lifetime, and things can be so bad that 5% of the population reports actually falling asleep while driving. So some scary numbers there. So what is your problem? Probably the top things that we do address in our office is just can't get to sleep, can't stop thinking, not allowing me to get to sleep, snoring. Snoring can further develop or be a sign of a bigger problem, sleep apnea, RLS or restless leg syndrome, not allowing sleep. A lot of patients find that they're waking in the middle of the night and not getting back to sleep in an appropriate amount of time, not dreaming, and then aches and pains, not allowing folks to sleep. So sleep is essential, and poor sleep is linked to many health conditions. Number one would be mood issues. During sleep, your brain forms connections to help you process and remember new information. The lack of sleep can negatively impact both short and long-term memory. Along with this commonly comes brain fog, trouble thinking, concentrating, being creative, problem-solving skills. See a lot of sleep deprivation that has caused many accidents, motor vehicle accidents. Patients have fallen off ladders from being too sleepy. One interesting statistic is that the Wednesday in the spring, after the clocks go ahead, is the highest day with the most work injuries, just due to that 1 hour of sleep deprivation over a few days. High blood pressure. If you sleep less than 5 hours a night, you're at risk for high blood pressure, which can increase your risk of heart disease. Risk of diabetes with sleep deprivation. A lot of sleep can affect your body's release of insulin, your sugar-lowering hormone. People who don't get enough sleep have higher blood sugar levels and then an increased risk of type 2 diabetes. With sleep deprivations, we see a lot more weight gain. When we're sleep deprived, the chemicals that signal your brain that you're full are out of balance. As a result, you may be more likely to overindulge, even though you've had enough to eat. During sleep, your immune system produces protective infection-fighting substances like antibodies, cytokines. Unfortunately, with sleep deprivation, we can become more vulnerable to bacteria and viruses. If you're unable to build up these forces, it may take you longer to recover from an illness. Sleep expert Matthew Walker, who is a regular consultant for the NBA, NFL, other corporations, his famous saying is, the shorter you sleep, the shorter your life. So let's just go over what is the appropriate number of hours that you need per night to sleep. So for ages 3 to 5, you should be getting a 10 to 13 hours of sleep per night. Ages 6 to 12 is 9 to 12 hours. Ages 13 to 18, 8 to 10 hours. And adults, at least 7 hours of sleep per night. I have a lot of patients that come into the office saying, "Doc, I get 5 hours of sleep, I feel good." But studies have shown that that is not sufficient, and we need to work on a closer number to 7 hours. So just to get a general understanding of sleep, we should understand its sleep cycles. Sleep cycles is all about measuring brain waves. EEG, or electroencephalograms, are used to measure brain waves, and it can measure the different 1 through 5 stages of sleep. Stages 1 through 4 are categorized as non-REM sleep, and stage 5 is REM sleep. So stage 1, in stage 1 of sleep, we are more in alpha and theta waves. Average time to enter this time or stage of sleep is about 7 minutes. We have found that meditation can be quite helpful for patients to enter this first stage of sleep. Meditation can be used to relax your brain and body, to allow you to more easier quell distracting thoughts and calm that busy mind. Studies have found that meditation can lower cholesterol, our stress-inducing hormone, and also can increase melatonin for a more restful sleep. Bridget's going to post some information on good meditation sites. particularly like Deepak Chopra. He has some very good free meditation audio video on YouTube. Also, the Calm app is used by millions of Americans for sleep stories and meditations. I believe it's about $60 a year, but really good quality meditations on that site. So stage 2 of sleep, we're seeing more theta waves. It's more difficult to wake someone up at this stage of sleep. We're seeing a slowing of a heart rate at this particular time, and the important drop in body temperature that allows us to enter the stage 3 and 4 of sleep. So stage 3 and 4, also known as deeper sleep or restorative sleep. We're seeing more delta waves at this time. This is a really important time for healing, repair of injuries, growth. Up to 75% of or human growth hormone is released during this stage of sleep. Studies have found that this stage is very important. When there are deep sleep deprivation studies, it is found that researchers have found that individuals will quickly skip stage 1 and 2 and rapidly go into stage 3 and 4 for this restorative repairing sleep. Stage 5, or REM sleep, also known as rapid eye movement. Most people know about this stage of sleep as it has most of our dreaming. 25% of sleep time is in this particular stage. We see an increase in heart rate, decrease in breathing. Without this stage of sleep, we're finding more risk of anxiety, depression. A lot of brain activity in this sleep stage. We're seeing memories are processed, brain repair, memories are resolved in this particular stage of sleep. Interesting, at this stage of sleep, there is less muscle activity, or called muscle atonia. Thought is that at this stage of sleep, the brain actually reduces your ability to move so you don't injure yourself, as your brain is so busy in this particular stage. So strategies to help you get to sleep. That's what you came for. Well, let's get into this information. So interesting fact is that warm feet have been found that 77% of folks get to sleep faster by keeping their feet warm, but then also good to keep the head cool. Research has shown that the proper room temperature for sleep is generally somewhere between 60 and 68 degrees. I've seen studies that have shown that even a room as cool as 56 degrees can be quite helpful. Meditation, we've just touched on that topic. Avoiding sugar and caffeine. Caffeine is a stimulant. It can affect patients quite differently. We do a number of genetic testing on patients in our office, and one of the common genetic factors that we look at is caffeine metabolism. Genetically, we can be predisposed to process caffeine at different rates. We have patients that could drink several cups of coffee in the evening and wouldn't affect their sleep. We have some patients that if they drink a cup of coffee after 2 o'clock, they can't get to sleep. So again, the importance of keeping a good sleep diary to see what affects you and at what time. In a moment, we're going to touch on sleep hygiene, get into some details on the room organization. Dr. Montague is going to touch on different supplements and nutraceuticals that can be helpful for sleep. And we're going to talk about some dietary thoughts on how to help sleep. So getting to sleep with proper sleep hygiene, setting a schedule is very important. Just a couple of things to think about. Many things could be stimulants that you might not be aware of. such as fish oil for some, B vitamins can be stimulants. Not a bad idea to take these sort of supplements in the morning or at lunch or not beyond that particular time. If you're participating in vigorous exercise, such as running, that can release high levels of endorphins. You wouldn't want to run in the evening. You may want to consider doing that in the morning or afternoon. It can affect your sleep. So we'll get into it a little bit later on dietary changes. So when you eat carbs could be important. Next thing is if you can't sleep after 20 minutes, don't watch an electronic device. That sort of light will give you more stimulating effect. Best at that point, if you can't sleep past 20 minutes, is to get up, maybe read a book, have a non-caffeinated beverage. Want to avoid napping. Generally, it's better to not nap, be tired for a short or a longer period of time to get back onto your sleep schedule. Exercise. A lot of confusion on, is exercise helpful for insomnia? It has been found through research that exercising for 4 weeks for folks who have chronic insomnia, they can get to sleep 13 minutes faster than if they had not been exercising. And then after 4 weeks, also the insomnia patients were found to be able to sleep for 18 minutes longer. Exercise can change your core body temperature. Initially, as you exercise, your body temperature increases, but then in a period of time after, the temperature actually drops. And as we learned about stage 2 of sleep, that drop in sleep can stimulate those sleep stages. Exercise can relieve symptoms of anxiety and depression. Exercise can mitigate anxious thoughts by allowing endorphins to be released, positively improving your sleep quality. Exercise can help us realign our internal body clock. If our internal body clock or circadian rhythm is out of sorts, exercise can boost our serotonin, which is a regulator of our circadian rhythm. So do have a lot of patients ask, will exercising cause insomnia? If we exercise too late and endorphins are released late, this can energize your body, leading some people to feel more alert and not being able to sleep. So for this reasons, experts recommend that avoiding exercise for at least 2 hours before bed can have the best effects. Timing your exercise can be quite helpful. As we talked about with stage 2, a drop in body temperature can be quite helpful. And it has been found that body temperature will drop approximately 90 minutes to 2 hours after falling asleep. We have a number of patients that find it helpful to do a moderate exercise, such as doing yoga, maybe between 7 and 8. They've increased their body temperature at that point. Over the next couple of hours, we could find that their body temperature decreases just about the time that you may want to fall asleep at about 10 o'clock or so. So timing your moderate exercise in the evening can be quite helpful. Alcohol at certain amounts, certain times, can have negative effects on sleep. Drinking alcohol does cause your liver to be more active, increasing your metabolism, which will increase the heat of your body. If you time that incorrectly, that can interfere with sleep stage 2 as you're trying to get into stage 3 and 4, so it can alter your sleep. Alcohol also is a depressant, and if alcohol has not been broken down in time, as your body is trying to enter REM sleep when your brain needs to be busy to create memories, that can interfere with REM sleep, And REM sleep is so important for so many factors. So it's generally recommended that you do not drink alcohol for 2 to 3 hours before going to bed. Next complaint, I can't stop thinking. So we're going to get into some nutraceutical or supplement type options to help with sleep. Just going to have Dr. John get into a discussion on our product, Lights Out.
Lights Out is a great product because it comes in as a chewable. So it's easy to take, and 2 capsules give you everything you need to help your body make melatonin. It includes melatonin, but it also includes things such as 5-HTP, which is a precursor to serotonin, which is a precursor also to melatonin. The B6 also facilitates that process. And getting back to thinking at night, one of the things that I've always found to be very successful in turning off the brain is to take inositol. It helps to shut the brain down, helps you relax. So that this formula is a really nice sleep formula for that.
Definitely Lights Out, our next product, probably our top most reordered products. We find them to be very helpful. So let's get into the next product, Mag Relax. Just going to have John give us his take on that product.
Yeah, magnesium is very important, and not all magnesiums are created equal. The thing about Mag Relax is you have magnesium biglycinate, and the difference is this makes it so that you get the magnesium in your body. A lot of magnesiums don't absorb very well, and they stay in your colon and pass through you. Once you get the magnesium, it just helps your body relax. It helps slow down the heart. In fact, I just saw today that the FDA is they're going to allow claims for magnesium to help with high blood pressure. So it's a great product to help with stress. Mag Relax, perfect for helping you sleep at night.
Thanks, John. So a big area of concern is snoring. Snoring can have many negative side effects on your health, so it is really important to try and resolve it as possible. Snoring can be a sign of a more serious condition known as sleep apnea, where we can actually stop breathing for a period of time. We can have thus a decrease in oxygen to the brain, heart, other important tissues. So if we're suffering from sleep apnea, important to seek medical advice, medical evaluation, and potentially co-treatment between doctors. So just to get to the facts on snoring, excessive daytime sleepiness and fatigue can be seen with snoring. Headaches in the morning, particularly with the sleep apnea patients, you see that. Trouble with memory, learning, concentration, high rates of mood swings and short-temperedness with snoring. So what are some of the causes of snoring? Overeating or lack of exercise can cause fat to gather in the back of the throat. So back to the importance of exercise. Wrong sleep position that may be suitable to you can affect snoring. If you sleep on your back, for some folks, by gravity, your tongue will slide down into the back of your throat, which can cause obstruction of airways. We're going to go into some exercises here in a moment that could help with snoring. Allergies, this could be from the room. Allergies can create inflammation, so reducing inflammation that could be from multiple sources of allergies can be helpful. And snoring can be a sign of a more serious respiratory illness, and if you're having trouble getting rid of snoring, it's becoming more of an issue, definitely always also good to have a checkup by your primary care physician. So some supplement or nutraceutical options for treating allergies and reducing inflammation. Just going to have Dr. John speak on that.
So the first thing is NAC Max, and N-acetylcysteine is a very powerful supplement. It's actually, if you have Tylenol poisoning, that's the first thing they're going to give you is a IV of NAC because it helps to get the toxins out. But at the same time, NAC is very helpful for loosening up the mucus and mucous membrane. So This helps to make it easier to breathe at night, can be very helpful. The other thing is, I just read some recent research that NAC can be very helpful also in helping you get to a deeper sleep. The other product, triple SPMs, this is talking about the inflammatory part. A lot of snoring is due to inflammation. SPMs are the part, fish oil is supposed to be very good for inflammation. The SPMs are what comes from fish oils to help with inflammation. So this is getting to the anti-inflammatory part of fish oils. So SPMs can be very helpful, cut back that inflammation in the sinuses, even help with allergies as far as that goes.
Okay, thanks, John. So some exercises for snoring. Certain exercises can be fantastic to help reduce snoring. It's found that about doing these exercises for about 10 minutes a day, maybe for a few weeks, up to 3 months, can help build up muscles along the tongue, mouth, face. We could practice a couple just to give you a sense of how these mouth and tongue exercises can work. So I'm just going to go through it, and we can all give it a try. So if you would like, you could place the tip of your tongue against the back of your top front teeth. So say it again, as we're getting out of our routine here, just listening. So again, place the tip of your tongue against the back of your top front teeth. Slowly slide your tongue backwards with the tip moving along the roof of your mouth. So again, your teeth are up against the top of your front teeth, sliding your tongue back against the top of your mouth, and you can really feel those muscles of your tongue kicking in. Again, you could repeat that up to 10 times. Again, great for strengthening the muscles of the tongue and throat. Another favorite of mine to give out is the tongue push-up. You can just stick your tongue up against the roof of your mouth and then press your entire tongue against it. So again, just stick your tongue up against the top of your mouth, press with a moderate level of strength up against the top of your mouth. You can really feel that muscle kicking in, and it can really improve, again, your tongue and soft palate tone and strength. Certain facial exercises can be quite helpful to decrease snoring. One I like to give out is called the chin hook. For this one, you can place your thumb or index finger under your cheek or chin, and you can pull your face outward. At the same time, try to take your facial muscles and pull your cheek back inward. So again, hook the finger around your cheek, chin, pulling out at the same time, pulling back with your facial muscles. Great for allowing a proper closure of the mouth while you're breathing. For folks with snoring or sleep apnea, important to learn to breathe through your nose while you're sleeping and not through your mouth. So with this, we can practice by have your mouth closed, your jaw relaxed. Inhale through both nostrils, hold your breath for a moment, press one finger against one nostril, and slowly breathe out. When you're done, breathe back in through both nostrils, finger on the other nostril, breathe back out again. You go back and forth 10 times. You may find that one nostril is more difficult than the others. This could be a sign of inflammation, and you want to keep working on that until that congestion is worked out, either through practice or decreasing inflammation through maybe some of the products that we've already talked about. So healthy foods for decreasing snoring, and that can be helpful for many other things. I'd like to advise pineapple. Pineapple is high in bromelain. Bromelain is a great natural decongestant that can decrease nose and throat flare-ups. Avoiding milk might be helpful for some. Milk can increase mucus. You may want to consider soy or oat milk. Taking turmeric or having turmeric more in your diet can prevent inflammation in the nose and throat. Some patients find that a little raw garlic later in the night can be quite helpful, can be a great anti-inflammatory, also a well-known antibiotic. Peppermint can decrease spasm of muscles or just create or decrease tight muscle fibers. You can have that in a tea or a nice steam inhalation. And I think many of us know that honey can be quite helpful for soothing nasal pathways and the throat. Okay, so let's move on to restless leg syndrome. Often a mystery in the cause and can be really weigh on the patients who have restless leg syndrome, as it's very complicated to treat and to get good results. There's believed that it's probably due to a genetic predisposition that is brought on by some sort of environmental trigger that then creates a neurological condition. Most likely a change in the dopamine pathway that's similar to how Parkinson's comes about. Common findings also is that there is a low iron in the brain. Restless leg syndrome tends to be flared by alcohol and caffeine. And John is going to review one of the products that we have found to be quite helpful, Backsprin.
Yep, Backsprin's a great product. I actually take this before I go to bed at night. I like it, I like to prescribe it for restless leg syndrome because it has a lot of magnesium in it. Magnesium is very helpful with restless leg syndrome, but it also has some herbal muscle relaxers in it, which help to just relax the muscles, decrease that tone so they aren't overactive at night, helps to diminish it. So this is a great product to be able to use with restless leg syndrome.
So waking up at night, common complaint, waking up at night and not being able to fall asleep within a particular amount of time. This can be a condition of blood sugar, and with that, we generally have these sort of conditions monitored by our naturopathic physicians, maybe in connection with a patient's endocrinologist. Some things to consider to see if that is actually a factor for you is at supper time to potentially decrease the amount of carbohydrates in your diet. Having a protein snack before bed can help you figure out if your waking in the middle of the night is due to blood sugar. We use a number of different natural compounds to help regulate or modulate blood sugar, such as chromium. But this is definitely one of the conditions that you want to work with your endocrinologist and naturopath in combination to make sure you're on the right treatment path. Light therapy. About 2 years ago, we added a TheraLight 360 to our practice. Have a number of patients that have had great success with the TheraLight 360. Probably a couple of main reasons for bringing it into our office is systemic inflammation. Light therapy, when provided to the body at certain wavelengths, can be quite effective in reducing inflammation. Also, we have found in our office, and as you can see here with this study from the Harvard Department of Psychiatry, which uses light therapy, they found it to significantly improve patients' mood. With the combination of mood improvement, decreased inflammation, a lot of our patients who do have sleep disorders will see success in that area as well. So how does light therapy work? Well, red light therapy or infrared light therapy are all considered to be photobiomodulation. And what they treat is oxidative stress or stress on cells. This can be due to free radicals. When light is absorbed by the body, free radicals can be removed from the body. As free radicals are decreased, inflammation can be decreased. Then your body's natural energy, also known as ATP in biochemical words, as ATP increases, energy increases, more energy for healing, enhanced mood, and then in our discussion, hopefully better night's sleep. So waking stress and cortisol. It's going to have John talk about our product ComStat.
Yeah, so many people wake up in the middle of the night, and it's probably one of the bigger complaints I get is they wake up and they're wide awake in the middle of the night, and how to get back to sleep. And so one of the things that I've found to be very, very successful for that is using GABA, which is what this contains. And this comes in basically in a chewable tablet where you just take one or two when you wake and you suck on it, and it just helps your body get back in a relaxed state and get back to sleep faster. So excellent product to use when you're waking up in the middle of the night and you want to get back to sleep.
Thanks. Important to note at this point, if you are taking other medicines that are used for stress and anxiety, really important to consult your medical physician or naturopathic doctors to make sure that there's no interactions between your prescription medications and your nutraceutical or supplements. Acupuncture for sleep. I've been practicing acupuncture in our office since 2008. I have several techniques to treat sleep disorders. For chronic sleep disorders, generally one of our protocols can show significant results over about a 6 week to 12-week period. For those suffering from mild insomnia due to pain, as little as 3 to 6 treatments can be quite helpful. Acupuncture can work in 3 different ways to help improve sleep. Acupuncture can decrease the chronic pain reflexes that are set up between muscles and the brain. And by calming those reflexes, we can relax the body. Acupuncture can increase blood flow and thus improve injuries. Trigger points can be reduced, painful trigger points through acupuncture. Stress and anxiety can be reduced through acupuncture. Some of the points that we have listed here, just to go through a couple. Heart 7 on the palm of your hand can help quell excessive anxiety. Liver 3 on the foot can help with the smooth and easy flow of emotions and decrease emotional outbursts. Yin Tong, the point between your eyebrows, can help with clarity or decrease repetitive thoughts or OCD type behaviors. And Lung 7, great to improve breathing, respiration. Acupuncture can also be a great hormone modulator. Studies have shown that the stress hormone cortisol can be reduced with acupuncture. Also, acupuncture can be very helpful for reducing heat in the body and can be quite helpful for relieving menopausal symptoms. So just to go back over some ways to enhance stage 5 or REM sleep, avoiding sleeping pills, which can be depressants. If we don't have to take those, that would be great, because as we've learned, depressants can hinder REM sleep. Melatonin can be great for a restful sleep. A multi-mineral or multivitamin can be important to give us all the nutrients that we need for stage 4. CBD oil has been scientifically proven to be quite helpful for sleep. Room temperature we spoke about, and so let's go into proper comfort and support. Common question for me at our office is, what mattress or what pillow should I use? I really like the website sleepfoundation.org. There's some really great reviews on mattresses that you may not be thinking about. Number 1, I think a lot of my patients do like is a Sleep Number bed. Can be very adjustable to find the proper body contour. Generally, it is adjustable on both sides, so good for each partner. Tempur-Pedic mattress or memory foam can really mold to the contour of your body. One negative component is that it can be less breathable, which warmth can become trapped in it. But I believe for a couple $100 more, a cooling option can be added to it. I do advise for most patients to shop at a store that has a 90 or 180-day return policy. So if you don't like your mattress, you can bring it back, try something different. Pillows, at our office, we carry Core pillows, C-O-R-E. I think they're great quality pillows at a reasonable price. A lot of patients will ask me, is a memory foam pillow a good idea? I do think for someone who has inflammation in their neck that the memory foam may be too aggressive of a pillow, so maybe not a good idea if you're in pain. I prefer a down-filled pillow and maybe moving to a memory foam later. If you're a side sleeper, having a long queen-type pillow between your legs, between your knees, can be great to keep your spine straight. Also, if you're a side sleeper, very important to keep your nose or your spine kind of even through the rest of your body. Having enough pillow that doesn't allow your head to drop down too far, or having too much pillow to push your head too far up can create spinal alignment issues. Next couple of slides, we're going to go into the nervous system and the spine and its effect on sleep. Our spine, made up of generally 3 different segments: cervical spine, thoracic, lumbar, also have the pelvis. Cervical spine is made up of 7 bones, thoracic spine 12, lumbar spine is made up of 5 bones. Between each of these bones, spinal nerves come out. They go to different parts of your body, help us sense, allow us to have different function, go to our eyes, nose, throat, chest, hands, legs. So therefore, if we're having trouble within our nervous system, this can create headaches, numbness, hip, low back, knee pain, can interfere with our sleep. So how can your posture affect your sleep? Just taking this a little bit further, everybody's head weighs as much as a bowling ball. If we have what's called anterior weight bearing, or our head is too far forward on our body, these days of using iPhones, laptops, majority of my patients have significant problems with anterior weight bearing of the cervical spine. If your head is too far forward on your body, it can tighten the muscles in your throat, which can make breathing difficult, sleeping difficult. Often we see with this condition, shoulders are rolled forward, compresses on the chest, can't get a good breath, also interfering with sleep. A way to check your own posture, either in the mirror or have your partner to help you. If you're looking into a mirror, you want to imagine a point between your eyes, down through your chin, down through your breastbone, through your knees, and see, am I in alignment in that way? Also looking into a mirror, we can imagine looking horizontally. Are my shoulders straight across? Are my hips straight across? Are my knees of equal height? This can show a lot of unleveling. One of the best ways to really look at anterior head displacement is have somebody look at you from the side. When you look at someone from the side, proper posture is that the whole of your ear should go through the center of your shoulder. It might be not out of the ordinary to have the ear hole maybe a half an inch forward on the body. We have patients coming in with anterior head placement of up to 2-3 inches. Again, that can lead to significant issues with neck tightening, chest tightening, thus difficulty sleeping. So I want to thank everybody for coming tonight. We did our webinar here in about 40 minutes. That's great. If you'd like to ask us some more questions, you can schedule a discovery call up in the corner of the chat. You're going to see a box that you can schedule a call with one of our medical office assistants. If you have questions about the webinar, about products, anything that we're unclear about, set up a call, and one of my medical office assistants can reach out to me or Dr. John, and we can give you an answer. Otherwise, if you're thinking maybe I should get a chiropractic visit, or should I have an acupuncture treatment or chiropractic evaluation, or should I talk to one of the naturopathic physicians, is a great opportunity to learn more about the office and speak with our assistants. Our phone number, and Bridget's probably shared our website information. Thank you very much for joining us tonight. Have a great evening. Thanks for attending.